Governor Kathy Hochul recently announced increasing access to emergency overdose kits in domestic violence programs. Tonight, WENY New York Capitol correspondent Elise Klein joins us live to explain how the new initiative will help DV survivors. Elise.
Renata, good evening. This initiative is part of the state's grand effort to address the opioid epidemic and New Yorkers' access to life-saving resources. Over the past 18 months, New York has distributed about 700,000 overdose emergency kits statewide, and many state leaders are stressing that domestic violence survivors are at a greater risk for substance abuse and overdoses, making their access needs high.
And so this is, just another way of really thinking about how to get life-saving resources out into the communities that need them the most.
The Office of Addiction Services and Supports, or OASIS, is coordinating with other state agencies, the Office for the Prevention of Domestic Violence and the Office of Children and Family Services, to connect with shelters and programs about setting up the overdose emergency kits. The overdose emergency kit is a wall-mounted metal box that contains naloxone, a medicine to rapidly reverse an opioid overdose, instructions on how to administer naloxone, a breathing barrier device, and fentanyl test strips. Cunningham says this initiative is a first step to getting more of these emergency kits in communities and public buildings.
I believe that naloxone should be everywhere, should be in every community.
Cunningham says their office will be looking at how this initiative does as they consider potentially putting these emergency overdose kits in other places such as schools or libraries. Cunningham also says this initiative will help bring awareness to the issue of substance abuse and help break down the stigma against getting help. Renata, back to you.